my name is Catherine, and welcome to Sparrow Podcast. My guest today is Muhammad Ali Ilyas, and he has a master degree in clinical psychology. He is licensed to practice in Dubai, and he's also a neuromarketing consultant and a corporate trainer. He's driving behavioral change and empowering individuals and professionals through psychology and using also different insights from interdisciplinary fields. He works with individuals but also with organizations and helps them to find their meaning in life and to become more successful and empowered. Hi Ali, thank you so much for joining me today.
Hi, thank you for having me.
I would like to know what makes you so passionate about psychology?
Um, I had a few different interests intellectually when I was in my late teens. One of them was philosophy. And I understood philosophy as an 18 or a 19-year-old does understand philosophy
Okay.
poorly.
Okay.
And then I was also very interested in magic and mentalism, and I found it so
Okay.
fascinating how the mind works and how the mind is both this tool that can be used for such amazing things, but also something that can be fooled so easily. So I started developing a real interest in my late teens in the workings of the mind, and then my own history of my own struggles with mental health, my family struggles with mental health. All of those things sort of just came together, and it just made sense. I knew since I was 18 that I wanted to be a psychologist. So yeah,
Okay. Great.
yeah.
Great that you found that very early in your life.
Yeah, I think I'm very blessed to have found that very
Yes,
early.
for
People
sure.
struggle for a very long time to figure out what it is that they're really looking for in life or what their
Yes.
calling or their purpose is. I think I found it, discovered it, and then decided that this was the path I wanted to take at a very young age. And I realized more and more as I grow that I'm incredibly lucky for that.
Okay.
Yeah.
And I'm sure that, as per your experience, you deal with a lot of people who face challenges
Yeah.
and emotional hardships. And in your opinion, what are some of the most rewarding things about therapy?
So when you ask me that question, are you asking what is most rewarding for me as a therapist?
Yes.
Ah, I think the most beautiful thing about being a therapist is when you have spent so much time with a person, hours and hours over weeks, months, and sometimes years, and you see them change, and you see their own perspective of themselves shift. You see them start to become proud of themselves in the way that they behave and they engage. Or if it's someone with a severe mental illness and you see them improve, you see them get back to their life, their meaning, their purpose. I think it's so beautiful to be on that journey with a person. And it's when you've done a good piece of work, a good piece of work of psychotherapy with a patient, when therapy comes to an end, it's almost bittersweet in a way,
Okay.
because you, you know, psychotherapists, the field that we're in, the helping fields, you actually create a real relationship with these people. So you sit with them in their hardest times, and then when they're finally doing much, much better, where they don't need you as much, that's when we might say, okay, we might bring up a conversation of maybe it's time that therapy comes to an end. So it's almost bittersweet in a way. You're very
Okay.
happy for them, and you also, uh, you will always wonder, oh, I wonder how that patient is doing. I wonder how this patient is doing. I hope they're doing well.
Okay.
Yeah. So those are some really rewarding things. I think um, you, most people who go into therapy, if they trust their therapist will know them better than most people in their life do, because they will share some things that they might not feel comfortable sharing anywhere else. They might admit things that they have a hard time admitting to themselves. And I think it's a real privilege to be able to find yourself in that position where you can be trusted like that, and where you can help a person
Okay.
during a very difficult time. Yeah.
Okay. It sounds very nice.
Yeah.
And I know that your work is not related only to individuals, but also to organizations.
Yeah.
And I think that is so important, especially nowadays. So if we look back then, uh, we would measure the success of a company back in the days um, through these numbers or financial indicators like turnover, expenses, profits, and so on. And while nowadays these indicators are still important when evaluating a company, I think that the success of a company is mirrored nowadays also through social lenses. And what does that mean for me, or how I would translate this? It's when companies are responsible for creating the proper environment for their employees and management in order to strengthen the collaboration between departments, to encourage them to develop themselves constantly, to help them unlock their full potential. Um, so I am sure that through your expertise as a corporate trainer and also with a master degree in psychology, I'm sure that you have driven a lot of success for organizations in your previous work. So, can you please tell us more about your work in this area?
Yeah, yeah. So as far as corporate trainings go, the experiences that I've had have been corporations bringing me in to speak about things like stress management, um, how to navigate mental health difficulties in the workspace. I've spoken to different people in management in these organizations on what they can do to address mental health concerns in the workspace through their occupational health and safety policies. So I've given talks on a variety of different subjects, from stress training to assertiveness training, and that's to work-life balance. And assertiveness training is that's always that's always an important one, because an organization might want their employees to be assertive, but then if an organization is exploitative, whether that's in work hours or things like that, they don't really want me to teach their employees assertion. And I've actually had conversations where they both want me to give this workshop, but then they're also worried about the outcome of it.
Okay.
Because if an organization is exploiting its employees, whether that's through work hours or asking them to do tasks later, or by withholding their payments and things like that, employees have rights. And whenever I'm in an organization, even though I've been brought in by the organization, I do tend to feel a greater sense of, I'm speaking to the audience, I'm speaking to the people who are working there. And a lot of the times there is management working there.
Okay.
But there are some tricky areas to navigate when we're talking about work-life balance and assertiveness training, and what culture the management of an organization has is really going to determine how open they are to tackling topics like that in their
Okay.
organization as well. So most of the times, organizations that have asked me to speak on that are organizations that are doing their best to care for their employees.
Okay.
Other times, organizations have asked me to speak on that, thought about it, and then decided maybe it's not in their best interest. So it's tricky.
Okay.
Yeah.
Okay. What would you say are the benefits for organization to work with a corporate trainer?
So depends on the kind of training they're doing. I'll specifically say that what the benefits might be to work with a corporate trainer who is a psychologist. So you spoke earlier about profits and profitability and financial gains that a company makes and stuff like that. We now understand much, much better today how our state of mind and how our mental health impacts our ability to work and be productive in the workspace. And the better we are in terms of our mental well-being, the better we are going to perform. And I'm saying this very simply, but there's a lot of research and a lot of data that has indicated time and time and time again how people who are more supported in the workspace actually earn those organizations more money as well. So, yeah, so if you're bringing in a psychologist as a corporate trainer specifically to tackle mental health in the workspace, or if you have, and not just one training, but if you have someone coming in on a more regular basis, if you have some sort of program for the employees' mental health care, you're going to be creating happier employees. You're going to be creating more productive employees. And that benefits your employees greatly, but it also benefits your firm greatly. Not just in terms of work culture, which is incredibly important, but also in terms of things that the CEOs might look at, like financial gain. So all of these things go hand in hand, and it's something that can help everyone on all levels if people can bring in trainers specifically in the field of psychology to talk about mental health. So yeah, I think those are some benefits that people could have.
Sounds good.
Yeah.
And work is such a big part of our lives. I mean, we spend so much time and so many resources at work. And poor work conditions can take a toll on the mental health of the employees. So, as per your experience, what would you say are the most common um, mental health issues which origin at work?
With origin at work,
Yes.
I would say the biggest one off the top of my head is when people have controlling and toxic relationships with their management, with their
Okay.
bosses. As you just said, work is such a big part of our lives.
Yes.
If you're in the office 8 hours a day, that's almost a third of your life. When you start working, you're spending a third of your time at work at the very least.
Yes.
And so if your relationship with your supervisor, your line manager, your boss, whoever it may be, is one that's very unhealthy, where you don't feel nourished, but in fact, you're constantly feeling anxious, you're constantly feeling tired, burnt out, it's going to lead to a lot of problems. So I think that's one thing that, and now speaking more of my psychotherapy practice, when I have people coming in from the corporate sector in psychotherapy, that's the thing that I see most commonly. Now, I'm not citing any data here. This is just in my experience, in my practice. That's the complaint I've seen most often, where people really struggle with having a good relationship with their bosses, and it really creates problems for them, not just in a practical sense, but also in terms of their mental health.
Mental health.
Yeah.
Okay, so I intentionally brought into discussion mental health because one of the goals for my podcast is to raise awareness about mental health. And not because it's a trendy topic, but because I think it's so important and it's such a sensitive subject. While we are focused to treat our visible ones, we often tend to ignore or want to avoid our invisible ones,
Yeah.
which relate to our mental health. And I know in one of your posts, you write about the importance of promoting this idea in the social media space with critical thinking and awareness. So I think that's a very important topic because nowadays everyone is posting
Yeah.
whatever on social media. So I would like to ask you to give us a bit more details about this relation between mental health and what is posted on social media and how we should consume all these articles about mental health.
It's really a double-edged sword because on the one hand, it is amazing that we have a tool through which we can help people understand things that they might not have previously known about mental health, because mental health has been a taboo subject for a long time, and now things are changing, largely in part because of social media. People are able to communicate with each other. They might be able to find help if there is none available in their area. You have you can also get therapy online now. You can get a lot of medical consultations online now as well. So in many many ways, it's been incredibly helpful. People know more about disorders that they otherwise never would have heard about. The amount of stuff that social media has done for awareness of mental health, it's amazing. The other side of that coin, however, is that anyone can say anything about anything, whether or not they have knowledge on said topic. One big problem with the way mental health is spoken about on social media is that people will make posts, and I'm sure you've seen this as well. 5 signs you have depression, 5 signs you have
Yes.
ADHD, 5 signs your ex is a narcissist,
Yes.
stuff like that. And it becomes this space for self diagnosis, and a lot of terms, a lot of clinical terms start losing their meaning. I'll give you a small example. Have you heard of the term trauma bonding?
Yes.
Yeah, you see it used in social media space
Yes.
quite a bit, right? Right. So for a lot of people, when they're casually using the term trauma bonding,
Okay.
they're saying that two people are bonding over their trauma.
Okay.
That's how people usually refer to the
Okay.
term,
Okay.
which is incorrect. A
Okay.
trauma bond is actually a bond of abuse between
Okay.
the person who is abusive and the person who is being abused. The trauma that the abused person is experiencing is creating a very unhealthy kind of bond with the abuser. That's a trauma bond. You've heard of Stockholm syndrome, where Stockholm syndrome is this thing where, for example, it was found that a lot of people who were kidnapped started really loving their kidnappers.
Yes, I've read about this.
Yeah, so
Yes.
that's Stockholm syndrome.
Okay.
That's a trauma bond.
Yes.
So it's very incorrect the way that term is used online, or even terms like depression or trauma. They've lost a lot of the clinical meaning when a professional uses that term versus the way you might see that term used online. They're going to look like two totally different things.
Okay.
So that's one issue with the way that these things are communicated online, is that they start losing their clinical meaning, even though you are speaking of them online in a clinical way. So that's a big issue. And then the other huge issue is self-diagnosis.
Okay.
So people, what I wish people could understand about diagnosis and diagnostic categories is our diagnostic manual, the DSM, the Diagnostic and Statistical Manual that's been made by the American Psychiatric Association that people in the field use for diagnosis. It says in the preface, I believe, that these diagnoses are descriptive. They are not explanatory. And I'll make sense of that in a moment. So what that means is, it means that if you have, let's say, low mood, suicidal thoughts, you can't sleep at night, or you're sleeping too much, you can't eat, or you're eating too much. And we take this cluster of symptoms and we might say this person looks like they might have a major depressive disorder.
Okay.
We are saying that these symptoms are called, we would call them depression. We are not saying these symptoms are because of depression. That is the difference between something being described and something being explained. So we wouldn't say this is because of depression.
Okay.
We would say this is called depression.
Okay.
The causes might be a whole lot of different things. They could be biological causes, psychological causes, social causes, environmental or cultural causes. They might all be coming together to actually have the person experience this disorder that they're experiencing. So these things are not explanatory, they are descriptive. And that's something that I would really like people to understand a bit better, to reduce the amount of self-diagnosis taking place. And if you do suspect something, even if you do suspect, okay, I might have this, the proper place to go to get a diagnosis would be a professional, psychiatrist or a psychologist. That route should be followed if someone worries that they might have something like that or their loved one might have something like that. But I do think we should ease up a little bit on the amount of self-diagnosis we do.
Okay.
Yeah. One thing that happens with diagnoses that are spoken about a lot, or terms that are spoken about a lot on social media, there's a cognitive bias called the frequency illusion, which is, once I have a new piece of information, I might start seeing it everywhere. So, for example, if someone told me that people who have ADHD are very inattentive, which is true. People who have an attention deficit and hyperactivity disorder can be characterized as quite inattentive. Some people are very inattentive who have ADHD, but there are also people who don't have ADHD that might experience inattention. And now you might start picking it up a lot more in yourself with this newfound information. You might start picking it up a lot more in your friends, in your family. And that is because of the frequency illusion, where once we have learned something new, we now will be seeing it everywhere. So that's something that's called the frequency illusion. And it works to, there's also something called the confirmation bias, which is once we believe something, we look for evidence that confirms what we already believe.
Okay.
So, and then also there's this element of selective attention that takes place. For example, if I were to ask you to look around this room and I were to ask you how much blue can you see, you would find a lot of blue. If I were to then ask you to select your attention and ask you how much green can you see, you'd find a lot of green. Things that you might otherwise pay as much attention to.
Yes.
Yeah.
I found out that you like reading about books written by Irvin Yalom. And I have to say, I also appreciate his work. And one of his books is the Schopenhauer Solution. And there are so many complex aspects in that book. And I'm sure we would need another podcast to discuss the complexity of the book. But one aspect that caught my attention was the confrontation with death.
Yeah.
And this book really makes you think about the inevitable end. I know that you talked about this topic also on the scene in one of your TEDx talks, which I think is amazing.
Thank you.
So I would like to ask, why do you think people see death with so much anxiety? Because since forever, since humanity existed, we were preoccupied with the idea of death. And some of them would see it as something morbid. Some of them would try to become immortal, which was not successful so far. So why do you think people have this anxiety towards this idea?
Well, it's impossible not to. Death anxiety is something that every human being experiences. And death anxiety is something that every human being will always experience. Sometimes it goes off the rails and sometimes it becomes very severe. And that's when it can cause us a lot of problems. Yalom actually wrote a book called Staring at the Sun that's specifically about overcoming the dread of death. The reason he titled it Staring at the Sun was very interesting. He said that thinking about death is a lot like staring at the sun. Eventually, you blink. You can't look at the sun too long.
Yes.
Right? So, similar to that, it's important for us to think about death. At the same time, we can't think about death too long because it's true that you and I could die at any moment.
Yes.
We do not know that.
Yes. Tomorrow is not granted.
Tonight is not granted.
Yes.
Right? The next hour is not granted.
Yes.
Even tomorrow is far. And however, and that's true. We acknowledge that on a mental level. We acknowledge that, But imagine if you were to actually start realizing that you could die any moment. Would you not be horrified?
Yes, definitely.
You couldn't cross the street if you're thinking a car could run me over.
Yeah.
And so it's a very natural part of being human to also suppress the idea of death. Because if we were constantly walking around thinking all the time about how we could die, then life would become very, very difficult to live. It would be very, very difficult to live any kind of life. So we have to walk this fine balance between completely denying the idea of death and letting it completely overcome us. And both those individuals, some individuals gravitate more towards death denial as a defense against death anxiety,
Okay.
and some just experience severe levels of death anxiety, and both of those can become clinical. And when I say clinical, what I mean is that our levels of anxiety can become so severe that they keep us from functioning properly on a day-to-day basis.
Okay.
Yeah.
Do you refer here at the illness anxiety disorder?
Yeah. So, illness anxiety. So, for those who don't know, illness anxiety disorder is essentially this disorder where people believe that they have some sort of horrible illness,
Okay.
even though evidence shows them that they don't.
Okay.
And there's usually two types of people with illness anxiety. There are people who go out to seek support. So, if they're constantly worried, let's say someone is constantly worried that they've just had a heart attack, they might go to the ER a lot to go and get their heart tested, and it might turn out every time that they're fine. And I've seen patients who twice a week will go and tell the emergency room that they worry that there's something wrong with their heart, and then
It's something which is self-inducted from their thoughts?
yeah, so they might just be anxious.
Okay.
And there's a fixation towards certain body sensations,
Okay.
or then there's a misinterpretation of certain things taking place in your body. So someone with a severe illness anxiety disorder
Okay.
might find a pimple on their face and think it's a tumor.
Okay.
They might get anxious, and obviously when you're anxious, you feel like you can't breathe properly, and they might think they're having a heart
Yes.
attack.
Okay.
They might find something wrong about the way their body is working and think that it's cancer or it's this or it's that. They will take something that might be small and imagine the worst possible scenario. So, and they really suffer. It really makes life very, very difficult to live. And so there's people who will then go out to seek help, and then there are people who will completely avoid it. There are people who will be so convinced that they are ill that they will just never go to the hospital out of fear of that confirmation.
Okay.
So yeah, that's what illness anxiety is, and of course, in the way that in the theoretical orientation that I use when I work with people, I obviously, when someone has severe illness anxiety, I want to go a bit deeper and understand what their relationship to the idea of death is.
Okay.
And that becomes a very important part of working with that, because it's quite surprising actually when you speak to people about who have illness anxiety, specifically if it's to the extent of it being a disorder, and they're worried about having this illness or that illness, and then you ask them, or you point out that it seems like all of these illnesses, all of these horrible illnesses you're worried about having, whether it's cancer or a heart issue or a brain tumor, it seems like they really seem to be representing that you are very scared of death. And to my surprise, most of the time when I ask this question, they haven't even thought about death. Their mind hasn't gone beyond the illness. But then when they start thinking about it, they realize, yeah, they are absolutely terrified of death and the path to death. So then that becomes a very important conversation in psychotherapy. And different people who work in different ways within psychotherapy, clinical psychology, might deal with that in different ways. But that's usually one of the strings I like to pull on when something like that comes, and then we see where it takes us. There's no determined path, but that I do think that is a very important part of working with someone who has illness anxiety disorder. Yeah.
Okay. And if we talk now about people who are actually ill and
Who are what? Sorry.
that are actually ill and are in their terminal phase, what kind of lessons do you think that we can have from the people who find themselves on the deathbed?
I think. Sorry about that. I think that you know. You referred to the TEDx talk I did a little while ago.
Yes.
One of the studies that I mentioned in that talk, and I'm going to have to recall here, so apologies if I'm recalling this slightly incorrectly, but there was this one study where they had people who were given terminal illness diagnosis where they were told they had a few months left to live, and people on death row who were going to be executed. They had them write about their life. And then they asked other people who did not have terminal illness, who were not on death row, they asked them how they might imagine someone like that might feel in that position. And the results were very interesting. People who were actually on death row, people who actually had terminal illnesses, used a lot more positive than negative words to describe their life. But people who were not in these situations wrote a lot more negative words, imagining what it might be like if they were in that position. And I think, if I'm not mistaken, the title of this paper was something like Death is Death Positive or something like that. Because how people, and of course, that doesn't mean everyone who experiences death will experience it in that way. But what we have seen is that one thing you hear often with people who have terminal illnesses and they don't have a lot of time left to live is that their life changed, and they started truly living in the present after their diagnosis. And there's some amazing books about that. There's this beautiful book by a man named Paul Kalanithi. It's called When Breath Becomes Air.
Okay.
And in that book, it's an autobiography. He was an oncologist who got a cancer diagnosis,
Wow.
and then he wrote about his journey towards death. And of course, he died as he was writing the book. Towards the end of the book, and then the epilogue of the book was written by his wife after he passed away. It's a beautiful book for anyone who might want to check it out. But death teaches us a lot of lessons. And as one of my favorite quotes about death goes, is that death is a lot like a lecture. You only fully understand the lesson when you are in the front row.
Okay.
So I think those people who have truly lost someone who is very dear to them, or those people who are in the process of losing themselves, those are of course, two completely different experiences. But those are people who truly learn the value of being in the present moment. And since we're talking about death, there's there's something that the Stoics like to say, memento mori, which means remember that you too shall die. And it's something that's been a part of many world religions as well. Remembering death, it's been a spiritual practice to keep death in mind. And the idea of that is not as morbid as it seems. The idea is one must keep death in mind for a few different reasons. If you keep death in mind, first of all, you can live more deeply in the present, because you realize that's all you ever have. You can't be in the past, right? You also can't be in the future.
Of course.
When you were in the past, it was the present. When you'll be in the future, only when you will still only have your present. You can only ever live in the present.
That's true.
Yet, the way that we engage with the world is as though we're going to live forever, as though there's this future we have planned. And it's important to plan, but you never know when it'll be taken away from you. So, as morbid as it seems, the idea of death is something that can help us be more present in life.
Okay.
Yeah.
That's very profound.
Yeah.
I know that you mentioned in your talk also this theory of terror
Yeah, terror management
terror
theory.
management
Yeah,
theory.
yeah, yeah. So terror management theory came actually from a field of terror management theory comes from social psychology in a subfield of social psychology called experimental existential psychology. They took a lot of work from Yalom. They took work from Ernest Becker, who famously wrote this book called The Denial of Death, and they wanted to test a lot of these ideas in experimental existential psychology. And the pioneers of this field, there were three or four. They wrote a paper. They've written many papers on the theory of terror management theory, and the idea essentially is that it attempts to understand how human beings manage the terror of death, hence terror management theory. So managing the terror of death, and they've gone in many very interesting directions in their studies. They've spoken about how culture is something that helps us defend against death anxiety. They've spoken about how judges will give harsher punishments when they are reminded of death, which is very interesting. People start to hold on more tightly to their worldviews when they're reminded of death. And how people will even answer questions differently if they are asked questions close to a graveyard and questions further away from a graveyard. So it's a very interesting body of work that, of course, has its limitations. It has its criticism, but it's definitely a very interesting body of work that's produced a lot of interesting ideas around how human beings manage the terror of death and how that impacts us on an individual level, but human beings on a cultural level as well.
Okay,
Yeah.
very interesting. And from your point of view, how should we face the idea of the inevitable end?
That's a difficult question for me to answer because I'm, of course, like many individuals, I've seen death in my life of loved ones. Um, but I don't think that that's something that I or anyone can really answer about how death should be faced. I think the only people that we can learn from are people who have given us great wisdom at the edge of death. I think that's wisdom that I value immensely to help me learn how to live my life better. And I think that for those individuals who do struggle with severe death anxiety, it might be really useful to go to a therapist or a psychologist who works with that. It might be incredibly useful. But how should we tackle this idea? I don't know how we should, but I think some things that we can do that might help is to not deny the idea of death so fully that we end up living our life like we will never die. Because then, when we can keep the idea of death sort of in the forefront of our mind, we can be more authentic in living up to our values in life. Because when you can remind yourself tomorrow is not promised, then you have to do the best that you can today. You have to be there for the people that you love. You have to act out of your values. You have to attempt to be the best version of yourself, and you have to treat most importantly, you have to treat people well, because you don't know if you'll be around to treat them well tomorrow or if they're going to be around to treat you well tomorrow. You don't know.
So kindness is important.
It's so important. And I think that when we can keep the thought of death in the front of our mind, I think it has the potential to make us more kind many times, especially to those that we love and we care about, because you don't know when it comes to an end, to a halt.
Can I ask, are you scared when you think about your death?
I think there are days, pretty much like everyone else, I can't think about death all the time. I'll think of it every now and then. I make it a habit to think of it often enough, I would say. I think what's scarier to me than death is how one dies. There are
Yes.
there are
I can relate to that.
yeah, yeah. There are painful ways to go. There are very painful, very difficult ways to go. As far as the experience of dying is concerned, I think dying of horrible illnesses that erode at our bodies, it's a very difficult way to go. I don't think there's any easy way to go, of course. But
Probably quick and rapid.
you'd say that it's interesting. No one will ever come back from the dead and tell us what was the best way to go.
Yes.
But when I talk to people, because of course, as a psychologist, I work with a lot of people who are experiencing grief from someone they've lost. I've worked with people who have lost loved ones to illnesses that took them slowly, and I've worked with people who have lost people quickly, car accidents or sudden heart attacks and stuff like that. Yeah, yeah. But to answer your question, because I went on a tangent, yes, I on many days I'm scared of death. On many days I might not be thinking too much about it, just like everyone else. But I think I definitely make an effort to think about it a little more than I used to keep myself grounded in my present day-to-day life, and to try and treat people that I love better. And I fall short. I fall short every now and then.
We all do.
We all do. And all you can really do is try, right? So, and I think this is something that helps you get more in touch with your values, at least to even know when you're falling short. I think the great tragedy is many people don't even know when they're falling short.
Okay.
Yeah.
And you mentioned that you are working a lot with people which are in
Grieving. Yeah.
periods of grief.
Yeah. Yeah.
So, what is some advice for people who lost someone dear to their heart? How to
Yeah.
deal with grief?
Oh,
I'm
grief.
sure we need another podcast
Oh,
for this.
100%.
But, yeah.
I'm going to try and give a short answer to that. Grief is such a universal human experience. We're all going to experience it at one point or another. And, you live long enough, you will lose someone that you love. I think that there are many, many lessons in grief. First of all, grief is so painful, and it's so painful for different people in different ways. And everyone will respond to grief differently. There is no, and grief does not have a timeline. Grief is not a disease. First of all, I want to say that grief is not a disorder, because a lot of people, when they talk about grief, and I'll get this question a lot, how do you deal with grief? And they're asking me that almost as though they might ask me, how do I deal with anxiety? Or, how do I deal with these clinical things that we might deal with? It shows that we as a culture at times view it as something that shouldn't be there. So first of all, I would address the question saying, you experience the human condition. There are parts of the human condition you will experience. You will not deal with them, you will experience them. There is, of course, such a thing as complex grief. I just want to quickly say complex grief is when grief is so severe that people might be experiencing hallucinations and suicidal ideation and things like that. There are points of grief where intervention might be necessary. But generally speaking, grief from loss, not just of people dying, but of relationships ending, of moving to a different country, the grief of losing an old life. There are variations of grief. And it's really important that whatever we do, we learn from them. We learn the things that we did not know earlier. We might have regrets, we might have thoughts, we might have reflections. Let those reflections take you to new places and who you want to be.
Wow.
And there's this quote that I have written on my wall back home by Alexis Carroll. And I think it's really, really beautiful. It goes something to the effect of man is both the marble and the sculptor.
Okay.
For man cannot recreate himself without pain. So grief is incredibly painful. It always will be. What's really important, to get a little more practical, is that you are using your support network. when you're grieving, use your support network. When you're grieving, fall back to the things every now and then, even in your states of grief, that make you feel a little better. It's important to not completely, it's not important to not deny the grief and to completely avoid it, but it's also important to create spaces for yourself where you can just feel something pleasant every once in a while. People don't imagine this. There are people who might be grieving and someone makes a joke and they laugh. That happens too. So it's really important to make use of the social connections that you have, the support network that you have around you when you're grieving. I think that is one of the most important things, to allow people to be there for you as you go through this process of grief, because it will take time.
Okay.
Yeah.
Usually, is it correct that usually grieving is like 1 year when it's very painful? I mean, of course, it's a different experience for every
Yeah.
person, and it depends what happened, and it depends on so many factors.
Yeah.
But I read somewhere that usually it takes 1 year
Yeah.
in general.
People have suggested that, and with the 1 year mark, I'll give you. It takes a year for all of those first things to pass. First birthday without them, first anniversary without them, first New Year's without them, first holiday without them. Those firsts are incredibly, incredibly painful.
Okay.
They're constant reminders of how that person isn't here anymore, and they're incredibly difficult. For many people, in that first year, those feelings of severe grief may subside. Yes, but that does not mean the grieving process is over.
Okay.
The grieving process is different, which is why it's really important not put a timeline like this.
Okay.
Some people might improve or might recover from grief in 6 to 8 months, but the grieving process is not over, because there will be moments where
course,
you carry that with you for the rest of.
Probably never over.
I'll share something with you. I lost my father when I was 8 years old.
Oh, I'm so sorry.
Thank you. And of course, when you're 8 and you
Yes.
experience that sort of loss,
Yes.
it impacts you. And then some time passes and you don't think about it much anymore. You're a kid. But I realize as I get older now, whenever something important happens in my life, I always find myself wondering, what would it have been like if my father was here in this moment? When something amazing happens, when something horrible happens, I think I grieve differently as a child. Then I grieve differently as a teenager. And then I grieve differently as a young adult and then an adult. I've just grieved differently in all of these different stages in life as I interact with my own identity.
Okay.
So in that way, that's what I mean when I say that, there will be moments throughout your life when grief will come back up. The way I often will describe it to my patients is, so imagine that it's like waves. And initially, when you start out grieving, when you've just lost the person who you love, the wave is incredibly high and it's incredibly intense. And then there might be brief periods of relaxation, or relaxation is the wrong word. There might be brief periods where the grief isn't so intense. And then it might go again like this. And so the waves might go like this. And then as time goes on, the waves are still there, but they get smaller,
Okay.
become less intense. So it goes like this, this, this. And you will never not have waves.
Yes, for sure.
And you will never not have waves, because the person you love will always ripple through your life.
For sure.
They're supposed to,
Yes.
right? That's the closest thing we have to immortality, to live in the hearts and minds of the people who love us. So they will always ripple through us in different ways. Sometimes you might find yourself having tears of happiness thinking about a moment once enough time has passed. So that's kind of how I look at grief, and I hope I've answered your question. It's a big one. It's the best I could have done given the time.
Yes.
Yeah.
Amazing answer, and so profound and so touching. And thank you also for sharing something from your
You're
personal
welcome.
life. And now, maybe as a conclusion, having in perspective the temporality of life, what do you think actually matters while we are here?
Ooh, I don't know how you conclude on that question, but I think rather than why are we here, I can answer more specifically for why am I here?
Okay.
Because I can't really speak for anyone else
Yes.
or impose their life purpose on them. But I think I found a lot of purpose in two things. Learning. I found a lot of purpose in learning. I like to learn as much as I can. I like to read a lot. I like to listen a lot. Be that lectures, be it through reading, whatever it may be, or even podcasts. And then I love to create some sort of positive impact through that learning, whether that's through the work I do in psychotherapy, corporate trainings, public education. In the past, I used to, I've done a lot of public education in the past, been on podcasts, different speaking platforms, stuff like that. For me, I find that those are things that give me great purpose in life. And I think that it's very important that people discover what that is for themselves as well. And not just discover, but invent. Because we don't just discover ourselves, we invent ourselves as much as we discover ourselves. Discovery sounds quite passive to me when someone says that they want to
Okay.
discover themselves. You
Okay.
can discover, and then
Yes.
through discover, with intent, you can invent.
Okay.
And so I think whatever purpose one has, or whatever purpose one suspects they might have, it's important to discover, but the end goal of that discovery will be invention. So, it's a question that philosophers, theologians, religions have questioned and then also answered. So, why am I here? I have my religious answers to that. I have my philosophical answers to
Okay.
that. And I have my personal answers to that. And then I have many questions too. But I think if I were to, sound like a total cliche, I would say that one of the reasons that we are here, that I hope we can do, and I struggle with this as much as anyone else, is try and be kinder to others. It's hard to do.
Yes.
It's quite hard to do, especially when we are upset and angry, and that's also when it's most valuable.
Yes.
So yeah, I think I've gone all over the place with that answer, but that's what I'd say to that.
Yes. It's amazing, I think. Thank you.
You're welcome. Thank you.
So, thank you for joining me today. I really appreciate your presence here and sharing all this useful information, but also all these deep thoughts. And thank you.
Pleasure. Thank you for having me.